Climb up, okay? There it goes. Preparing now to go into turbo count.
When Mayo Clinic researchers launched stem cells into space earlier this year, they were also launching hopes of growing the healing cells faster to meet the many needs of patients. In some ways, the mission was personal.
My mom died of stroke, and the same type of stroke that we are targeting for this stem cell study, hemorrhagic stroke.
A hemorrhagic stroke is when there's bleeding or a burst blood vessel in the brain.
Neurologist Dr. William Freeman's grandmother suffered a stroke when he was in college. He says it inspired him to try to find ways to help others like her.
When you see a patient or a mom or a dad return to their family, is priceless, and that's our reward, and that's what I think what we seek.
So Dr. Freeman and stem cell biologist Dr. Abba Zubair have teamed up in Mayo Clinic Cell Therapy Laboratory in Jacksonville, Florida. The FDA has granted them approval for a pilot study to use adult stem cells grown in this lab to try to heal the injured brains of a dozen stroke survivors. Some will receive infusions intravenously. For others, the stem cells will be delivered directly into the brain's chambers or ventricles near the injury.
When someone has a brain hemorrhage, it creates a cascade of inflammation. Mesenchymal stem cells, as we call them MSC for short, are powerful anti-inflammatory agents.
Stem cells are also powerful in another way because of their ability to differentiate into virtually any type of tissue.
We call them regenerative because they help tissues heal faster in ways that we're starting to study, and it's very exciting.
Regeneration is basically a restoration of function of nerve cells so that from damaged state to now fully functioning, rejuvenated.
The pilot study is expected to begin before the end of the year. For the Mayo Clinic News Network, I'm Dennis Doda.